At 6, the government's accused of presiding over one of the worst public health failures the UK has ever experienced. A report by MPs says thousands died because too little was done at the start of the pandemic by the UK government and its scientists to stop the spread of COVID.
The report criticised the UK government's pandemic planning as being too narrow. A herd immunity approach was a serious early error. Full lockdown should have come sooner.
They said the government's approach, backed by its scientists, was to try to manage the situation and, in effect, achieve herd immunity by infection. The report says the delay in introducing the first lockdown cost thousands of lives, many of them elderly and vulnerable people in care homes.
The report from a group of MPs found that COVID deaths in English care homes could have been avoided if the sector wasn't treated as an afterthought.
The report looks at decisions around the timing of the March lockdown. It says full restrictions came too late because the policy backed by government scientists and ministers was for a slow and gradual approach. The MPs say this was wrong and led to a higher death toll than would have happened with earlier intervention. The COVID pressure on care homes is examined in the report. The MPs say that sending elderly people from hospitals into care homes without prior testing may have been understandable, but it contributed to the spread of the virus. Staff entering care homes also may have carried infections. Staff shortages and problems getting PPE hadn't helped.
It is a weighty, serious report produced by committees chaired by two former Conservative cabinet ministers. Now, the government's been out today giving its defences, saying that, well, it followed scientific advice. This report says yes, but as you heard at the outset, that was flawed and ministers should have challenged it. The government says it acted to protect the NHS. The report says yes, but when the NHS looked like it might be overwhelmed. The government says that in the early stages evidence was thin. The report says, well, they should have looked to East Asian countries that had success in controlling the virus. Now, we know there's a public inquiry coming next year. The government says it will learn lessons, but I think it has a difficulty because this report has not satisfied the bereaved families. It has angered them. They say it shows things like the failings around care homes they've been trying to point to, and they want that inquiry to have tougher powers and report back earlier, they say, to prevent more needless deaths.